Time magazine just published its list of best inventions for 2025, and it's interesting, though perhaps a little worrying. Not least, for a guitar player like me, the LibreLive C1, which manages to do away with strings, replacing them with a touchpad and some impressive AI. All you have to do is strum, adding whatever air guitar flourishes you fancy, and you can suddenly play like a pro. Now, while there are some of these inventions, like a new Braille keyboard, with real potential for important impact, I couldn't help but wonder if others are a little, shall we say, frivolous. Technically immensely accomplished, demonstrating that classic innovation set of skills of developing and combining. But sometimes the purpose seems to be missing, or contrived as an eye-catching teaser, a piece of clickbait to draw us to look more closely at the underlying capabilities. Or, worrying thought, that really is all there is. Take the Nekojita Fufu, essentially an add-on to your Margor soup cup to cool down your liquid of choice. A rechargeable cat robot developed by Yukai Engineering to tackle the burden of constantly blowing on food. You clip it to the side of your chosen eating or drinking utensil, switch on, and instant cooling breeze. Technically pretty impressive, but as Frank Piller neatly pointed out in a recent LinkedIn post, you could always leave it to nature, who will invoke the second law of thermodynamics to do that job for you. A little more slowly and a lot less visibly, certainly at lower cost. Now, of course, there's nothing wrong with gadgets. I'm an enthusiastic early adopter, as a glance around my workroom will testify. I've got shelves groaning under the weight of things which looked like fun or fascination at the time, but which turn out to have half-lives shorter than a mayfly in June. The risk is that they demonstrate what's possible, but may not connect to a pressing need or deal with a job which urgently needs to get done, or at least done a whole lot better. So lists like that Time magazine one raise the question of what's innovation for? And a second question, is this really the best use of our ingenuity? That's a precious thing. It's got us out of plenty of trouble on our evolutionary road to here. And arguably we've still got a long way to go down that road in terms of our own and the planet's survival. A small matter, for example, of 17 sustainable development goals. That might be a good place to start. Or even simpler, some basic human needs which aren't yet fully satisfied. Those tucked away at the bottom of Maslow's pyramid, like food, shelter, clean drinking water, or simple sanitation, which is unfortunately still lying a long way out of reach of a scarily large number of people all around the world. Now, I suggest that if we were to list these big challenges still facing us in terms of our long-term survival, cooling coffee probably doesn't come high on that list. Now, the good news, of course, is that innovation is taking place towards dealing with these challenges, and it's been doing so for a long time. Harsh necessity plays the parent to a wonderful world of innovations which are trying to push back on some of these persistent survival issues. And it recruits a fascinating array of talents united in their concern for making the world a slightly better place. It also acts as a sort of natural innovation contest, drawing in possible solutions from a wide range of sources. For example, when the island of Haiti was hit by a devastating hurricane in 2010, much of the city of Port-au-Prince lay in ruins. But within a very short time, aid workers and locals began to piece together makeshift solutions to their problems, using resources such as mobile phones and a cellular connection. The sort of solutions they co-created and diffused included creating an instant banking system across which aid agencies could distribute cash to buy food, medicines, and other essentials. Or open street mapping to provide up-to-date information about affected populations, damaged infrastructure, key emergency locations, and so on. Reuniting displaced persons using the phone network as a database and communication center. Crisis mapping and emergency communications. Creating online access to key information, but also providing at least short-term employment opportunities. All this as well as providing resilient and fast voice-based communication. Now, importantly, this only touches on the mobile-enabled applications. Rippling around those were many others, not least something called Luminaid. 2 architecture students in the United States, Andrea Schrechter and Anna Stork, were so affected by the coverage of the disaster that they decided to try and do something to help. They kicked around ideas that might solve problems and realized that there was a particular requirement for something beyond food, water, and basic first aid supplies: light. Now, they already had a shared interest in solar lighting, and this led them to develop a simple, portable lantern, which has become a valuable addition to the toolkit available in disaster contexts, with thousands of these distributed in well over 100 countries. Importantly, the innovation extends to their funding model. Much of the finance they need comes from a give light, get light model, in which purchases of the lantern for recreational use in high-income countries, I have one myself, these purchases fund the donation of a second unit for disaster relief. Now, innovating to help deal with crisis conditions isn't new, but it has evolved considerably, moving from urgent fixes, the sort of sticking plaster mode, to capturing powerful learning about what works, when, and how, and then redeploying that knowledge in subsequent incidents. For example, UNICEF, the United Nations agency focused on the needs of children, can report on a steady stream of innovations which it's helped fund, develop, and implement, going right back to something called the Mark II handpump. Now, that one was originally developed in the 1970s to provide drinking water to Indian villages. Its simple, robust design made it possible to be manufactured in unsophisticated workshops, it was easy to maintain, and it emerged at low cost. It became the world's most popular hand pump, with millions of units deployed, and it laid the foundation for further updated versions which improved on its basic principles: clean drinking water for those in need. Now, this wasn't just a one-off success story. Something else, community management of acute malnutrition, CMAM. That was an idea originally piloted in 1999 to offer an alternative, decentralized approach to treating malnutrition. Importantly, it's a system innovation involving community outreach, outpatient care with specialized, ready-to-use therapeutic foods, inpatient care for more complicated cases, and services for moderate, acute malnutrition. Most importantly, it shifts treatment from specialized hospitals to community-level health centers and mobile teams. Agencies like UNICEF and the World Health Organization helped promote and diffuse this, and versions of CMAM continue to save millions of lives around the world. Innovations at the core of the system, like PlumpyNut, a peanut-based high-nutrition paste suitable for urgent feeding of severely malnourished children, they've been adapted, imitated, and improved over years to provide impact and scale around the world. In fact, by the end of 2024, UNICEF's global innovation portfolios reported 61 initiatives across 118 countries. Now, that was cumulatively reaching 38 million people. And they continued to coordinate innovation for their target group, children, effectively creating the ecosystem which brings together a diverse range of innovating organizations, creating things on the supply side, with a scale-up and delivery capability on the demand side, and a coordinating role to bring in key agencies like governments, donors, and other players. And of course, UNICEF aren't alone. These days there are multiple players on the innovation field, ranging from large agencies like the World Health Organization or the World Food Programme, through individual organizations like Médecins Sans Frontières, World Vision, or Practical Action, all of whom have their own extensive programs adopting, developing, and promoting innovation. And there's been a shift towards actively managing innovation in the sector. There's always been concern-driven innovation and a dedicated band of people committed to creating social value with their ideas. Think of Clara Barton, founder of the Red Cross, or Albert Schweitzer. But now there's a much stronger focus on systematic learning and development of competencies, both in organizational systems and in individuals. And we can chart this growing maturity in the proliferation of specialist innovation units and labs, in targeted funding streams and agencies, and in job titles and descriptions dealing with the role of innovation manager. Now, these days, innovation's an increasingly embedded approach, one which maps well onto best practice frameworks like that offered by the ISO in its 56002 standard for innovation management. We've reached the point where organizations like the World Food Programme not only win a Nobel Prize for its efforts to combat hunger, but it can also receive recognition for its innovative approach to innovation. In 2021, its Scale Accelerator was recognized by Fast Company magazine as one of the top innovation players in the social innovation field, and also amongst the best places for innovators to work. So, I thought it might be useful to try and compile a complementary selection to the one which Time magazine has produced. A sort of playlist of social innovation, my choice out of thousands of such attempts to improve things. Most of them aren't new. Some of them have been around for decades, but they continue to be adapted and improved. Others draw on new technologies to solve old problems, opening up new solution pathways. Many of them have morphed from their original origins, shedding skins and losing tails as they pivot towards becoming innovations which solve problems at scale. And thankfully, many of them have spawned a host of copies. While intellectual property battles have always been rife in the world of commercial innovation, it's often the opposite in the social space. Imitation is not only a sincere form of flattery, it also helps spread good innovation faster and more widely. So here's my starter set. First of all, Aravind, the Aravind eye care system. 50 years old, product of a silver entrepreneur's desire to give something back when he began his retirement. Not only a radical, new-to-the-world innovation, but rather a recombination of existing ideas to answer a powerful starter question: how to make available reliable and safe healthcare to those who can't afford or access it. In this case, good vision, which might otherwise be lost through the growth of cataracts. This was something that the founder, Dr. Venkataswamy, knew about as an experienced cataract eye surgeon. And not only does the model he developed work, involving basically a simple redesign of the core surgical process, but it's reduced the costs by well over 90% without compromising safety. Now that means an estimated 12 million people who might otherwise have gone blind can now see. But not only that, it also opens up a new approach which others have deployed to different medical challenges, like the LifeSpring hospitals with their perinatal care, or Narayana Healthcare, which applies the approach to heart surgery. It's essentially frugal innovation, rethinking the problem and the potential solution space. Think, if you like, of the low-cost airlines model applied to surgery. By privileging safety above all else, but then challenging anything else with the aim of enhancing access, it's doing for medicine what Henry Ford and Isaac Singer did for mass consumption, providing the enabling template. And healthcare is certainly something of a mass market. One which the oxygen plant in a box innovation contributes to. Second on my list, pneumonia kills 2,000 children under the age of 5 every day around the world. That's around one child every 45 seconds. Over 7 million children under the age of 5 in low and middle income countries need oxygen as part of their treatment. And COVID-19 turned this chronic problem into an acute crisis with many more children facing respiratory problems. They need oxygen. And conventional oxygen plants can meet some of the demand, but they're big and they tend to be located in major medical centres. The plant-in-a-box model is an attempt to simplify and decentralize this approach. It offers a low-cost, robust oxygen concentrator which can be easily installed, even placed inside a shipping container to allow for mobility. It's increasingly being promoted by UNICEF, the World Health Organization, and others, and plant-in-a-box solutions are now deployed in over 40 countries, helping meet the needs not only of children, but of an estimated 25 million people who die each year due to conditions requiring oxygen. So as the CMAM model for malnutrition shows, innovation isn't always embodied in products or deploying high technology. One of the most powerful success stories in healthcare has been community health worker programs. This model essentially equips local trusted community members with training and resources to deliver basic healthcare services direct to their community. And these CHWs have driven significant improvements in outcomes for maternal, newborn and child health, as well as for infectious diseases like HIV, tuberculosis and malaria. They typically fill the critical gaps left by healthcare workforce shortages and the problems posed by remote locations. It's a simple model with high impact. For example, programs in China helped eradicate smallpox, whilst CHWs in Bangladesh and Nepal have been instrumental in reducing under 5 mortality. They're reinforced by an increasing range of decentralized diagnostic and treatment technologies, moving them closer to the people who need them, often through simple portable technologies. For example, in Malawi, schools are used as points of care where trained teachers can provide malaria testing and treatment, not least helping to reduce school absences and improve education outcomes. And in Peru, community health workers distribute self-collection kits for cervical testing. This avoids the need for them to make a clinic visit and increases the screening rates in rural, impoverished areas, improving prevention rather than requiring treatment. Of course, exploiting new options in technology opens up new possibilities as well. Take, for example, the increasing use of drone technology. Companies like Zipline now use drones to deliver vital medical supplies such as blood, vaccines and medicines to remote and hard-to-reach regions. That model's been used in various parts of Africa, including Nigeria, Rwanda and Malawi. And mobile phone technology, again, as we heard with the Haiti example, has opened up significant new possibilities. Since access to a phone, if not ownership, is very high in many low and middle income countries, that can provide a platform for health services. Mobile health, mHealth applications can improve patient monitoring, medication adherence, education, and so on, and it can reach individuals in remote areas who lack access to formal healthcare facilities. The Cushy Baby system, deployed in India, uses a wearable necklace with a chip installed to store and track a child's vaccination and health records, and then those community health workers can access and update the records via mobile phone. Telehealth platforms can provide remote consultations via voice, video and text messages. They've been extensively deployed in countries like Sudan, India and across Latin America. Deploying innovative approaches to reducing cost and increasing reliability can also bring unexpected benefits. There's a long tradition of developing simpler versions of essential medical equipment for use in resource-constrained settings. For example, the Embrace Warmer is a low-cost way to provide incubation for newborn babies, combating neonatal hypothermia in areas where there's problems like unreliable electricity. But sometimes this has implications for higher income markets as well. GE, General Electric's simplified ultrasound scanner, was originally developed for local midwives in India, but it became a popular tool for small clinics throughout the world. And GE's simple ECG machine, the MAC 400, was originally developed for use in rural India, but it became widely successful in other markets because of its simplicity and low cost. It took only 18 months to develop for a 60% lower product cost, yet it offers most of the key functions needed by healthcare professionals anywhere in the world. Now, this was supposed to be a starter list, a short list, but already I'm overwhelmed by the richness and range of solutions available. And this is just looking at healthcare. Innovation is definitely alive and well in this space, though there is still plenty more to do. Healthcare is, sadly, of course, just one of those basic human needs which are not being met. And there are similar problems, similar scale problems around making sure that people have water that's safe to drink, food with which to survive, and some form of basic shelter. But the good news is that innovation is being channeled to try and meet these needs. And we are getting better at developing the organizations and the individual skills to create real social value with our ideas. So, as I blow on my coffee mug, without the aid of a robot cat, I'm somewhat encouraged. But there's still plenty to do.